Hello, my name is Dr. Dewan S. Raja. Today I will discuss about atrial flutter and atrial fibrillation. Let's start with atrial flutter. Atrial rate is always more than the ventricular rate in atrial flutter. Atrial contraction occur in excess of 200 per minute, usually 250 to 350 beats per minute. Ventricular rate is less because of physiologic heart block. This happens due to there is a refractory period in the AV node, so not necessarily all the atrial impulse will go to the ventricle. The conducting system of the heart cannot transmit all the atrial impulses to the ventricle. The ventricular rate is usually regular. The ECG looks like a sawtooth cock, best seen in lead 2, 3 and AVF. So always we look for sawtooth appearance in the ECG tracings. Okay, that is a feature of the atrial flutter. Okay, so atrial flutter with a constant 4:1 conduction ratio, that means for 4 atrial contraction, 1 ventricular contraction, 1, 2, 3, 4, then is the ventricular depolarization. 1, 2, 3, 4, then 1 ventricular depolarization. So this is here in this flutter we are saying 4:1, it may be 2:1, it may be 3:1. Rate atrial rate commonly 200 to 350 beat per minute. Ventricular rate is usually 125 to 175 beat per minute. Regularity usually regular. We are saying here regular. P wave. P wave is not a distinct P wave like that of the normal P wave of a normal ECG. Here, this looks like sawtooth appearance. These are abnormal P waves. These are sawtooth appearance like this. This is a sawtooth appearance, and we call it F wave. So these are we don't use the word P wave, we use the word F wave, and that looks like sawtooth. QRS ratio variable, most commonly 2:1, but it may be 3:1. Here it is 4:1. PR interval variable. QRS width normal. Drop bit none. So that is the atrial flutter. How can we manage? We have some non-pharmacological treatment like Valsalva maneuver, carotid sinus massage, or adenosine treatment. We have the ventricular rate control should be done, prevention of thromboembolic complication by anticoagulant, beta blocker, calcium channel blocker, or digitalis. We don't like to prefer digitalis here. Digitalis may act slowly, and digitalis itself may cause arrhythmia. Antiarrhythmic drugs, DC cardioversion, especially in an unstable patient. We need the synchronized DC cardioversion. Okay, so that is the treatment. This is the ECG tracing. Again, remember, sawtooth appearance, regular tachycardia. Okay, how about atrial fibrillation? Contraction of the atria in dysrhythmic and weak. This chaotic situation, the atria and impulse formation, multiple foci of impulse generation, and a lot of them are contradictory to each other. So it is dysrhythmic, chaotic situation in the atria in impulse formation. Rapid series of irregular spasm of the atrial muscle wall. Condition, the conduction system is malfunctioning. any contraction of the atria that gets to the ventricle is irregular. The ventricle contracts irregularly irregular. This is very important. Contraction of the ventricle irregularly irregular. P wave is missing. Most common sustained cardiac arrhythmia. It increases as the age advances. Around 5 million people in this country may suffer from atrial fibrillation. Atrial flutter every year around 200 to 300,000 people. Okay, this is more common than that of atrial flutter. Okay, so we are not seeing any discern. Here is the atrial fibrillation. We are not seeing any of the P wave. Okay, P wave is missing here, and here we can count the heart rate here. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. We will multiply by 6. 14, the ventricular contraction is around 84. Okay. So rate variable, ventricular response can be fast or slow. Regularity, irregularly irregular QR complexes. Look at the differences between one QRS, okay, QRS 1, another 1. Distance from here to here is different from here to here, is different from here to here. So this is irregularly irregular ventricular rate. P wave none, chaotic atrial activity. QRS, P to QRS ratio none because P wave is missing here. No definitive P wave before the QRS. Okay. Drop beat none. Can result in atrial stasis. So blood may stay in the atria. If it is staying in the atria because poor contraction, there will be collection of blood clot. There may be embolus formation that may lead to stroke or cerebrovascular accident. Treatment, rate control, anticoagulation like warfarin. Okay. Possible cardioversion, DC shock. Cardiogenic shock is essential in an unstable patient. This is a treatment. This is the complication. It may lead to stroke or cerebrovascular accident. Okay, so if you look at the atrial flutter, the impulse goes in this direction in the atria. This is superior vena cava, inferior vena cava. Suppose this is right atrium. Impulse is going in that direction. That is the atrial flutter. Okay, so this is atrial flutter. Here in atrial fibrillation, we have multiple foci, 1, 2, 3, 4, 5, 6, and the impulse is coming from multiple sources, and one depolarizes another one and another is counteractive. That is this may be countered by that one. Okay, multiple source of impulse from the atria. This is atrial fibrillation. This seems to be circular, but one side contract better than the other side. Clinical feature of the both almost same, atrial fibrillation, atrial flutter, palpitation, fatigue, dizziness, chest pain, tachycardia. Okay, irregularly irregular cardiac rhythm is found in case of atrial fibrillation, but in case of atrial flutter, it will be regular. Okay, so this is for okay. AFib, okay, but regular, usually regular for atrial flutter. Okay, we got that. Now, what are the causes of atrial flutter and atrial fibrillation? Common cause may be for both atrial flutter, atrial fibrillation. Ischemic heart disease, mitral stenosis, regurgitation will get almost same in the other side. open heart surgery, septal defect, pulmonary embolism, alcoholism, pericarditis, maybe even in hyperthyroidism. Like here, atrial fibrillation may be due to a complication of valvular heart disease, cardiomyopathy, myocardial infarction. There is something overlapping both myocarditis, pericarditis, congenital heart defect, ischemic heart disease, thyrotoxicosis, pulmonary embolism, hypoxia, hypertension, consumption of alcohol and caffeine may lead to atrial fibrillation, can occur in the absence of underlying heart disease. And this increases as the age advances. So after open heart surgery, we might have atrial flutter or atrial fibrillation. Due to some drug like digitalis or some antiarrhythmic drug may cause some type of dysrhythmia. We may have atrial flutter or atrial fibrillation. Okay, so that may happen on rare occasion due to drug. Okay, so we got that causes. Then we'll go to we have done the atrial fibrillation, atrial flutter. Okay, so atrial fibrillation, atrial flutter, we have gone through that part. Now we will summarize atrial flutter, regular, atrial fibrillation, irregularly irregular. POAB is totally missing in atrial fibrillation. POAB will be converted into multiple sawtooth appearance in atrial flutter. Okay, so atrial fibrillation is more common, atrial flutter is less common, but still around 200 to 300,000 people may suffer from atrial flutter in the United States. Maybe several millions of people suffer from atrial fibrillation in the United States. And also, we have to know that both of these conditions may lead to embolus formation, that may lead to stroke. So management by anticoagulant, management by anti-arrhythmic drug, okay, by beta blocker, by calcium channel blocker are the mainstay of treatment. Digitalis may be used, but its action is delayed. Okay, and in case of unstable patient, we need cardioversion by DC shock. Again, that's all about the atrial flutter, atrial fibrillation. If you have any question, please feel free to ask me. Please support my channel. Please subscribe me. Have a nice, wonderful, and blessed day. Bye now.